My name is Evelyn Dolce, and this is my presentation on cryopreservation. Here's the overview of the topics I'm going to discuss. Cryopreservation is preserving tissues and cells by freezing them in liquid nitrogen with the help of cryoprotective agents. When cryopreserving, the temperature is brought down to sub-zero. The item is seated and stored, and when needed, it is thawed out and cryoprotectants are removed. The goal is to maintain the medium and structural identity to ensure fully functioning cells. The procedure for freezing the cell begins with transitioning the phase from a liquid to a solid. When converting the solid phase, ice will form slightly before reaching its supercooled state. Ice will first form in the extracellular matrix, but since the cell membrane is permeable to liquid only, water moves out of the cell. Water moves out gradually due to the chemical potential gradient, which is crucial to keeping the cell intact. If ice were to form inside the cell during this stage, the cell would be greatly harmed. Seeding is the next process. This is intentionally inducing ice formation in a slow and controlled manner to improve the cell's survivability and reduce ice recrystallization. It is begun by touching a negative 196 degrees Celsius object to the wall of the container to cool a small portion of the solution. This cool temperature then spreads throughout the entire solution while the environment remains at a steady temperature, and ice forms. Due to the rules of enthalpy and fusion, heat is released during this phase change, and it goes into the solution. This ice is induced at a sub-zero temperature, which causes a slower release of the heat than if it were to be just a supercooled solution. This proves to be less harmful to the cell. Rapid thawing is preferred as opposed to slow thawing because when rapid cooling, ice crystals may reform. With rapid cooling, the ice crystals remain small, but in slow thawing, the crystals have a chance to grow larger, causing more destruction. The only precaution when rapid warming is extreme changes in osmolarity. It occurs so fast that the solute can get trapped in the cell, resulting in osmotic lysis. For rapid thawing, the cells are placed in a water bath of 37 degrees Celsius. Regarding the cryoprotectants, there are two types, permeating and non-permeating. This simply means if the preserver penetrates the cell or if it remains external. These chemicals are used to prevent cell damage from ice and high sodium levels as this process progresses. Typical permeating agents are dimethyl sulfoxide, 1,2-propanediol, and glycerol, which is widely known for its use in cosmetic products. Common non-permeating cryoprotectants are glucose and sucrose, which are familiar with as sugars. These saccharides are too large to fit through the cell but utilize osmosis to move all of the water out. This again removes the water, which removes the chances of ice formation. For cryopreservation of embryos and oocytes, sperm, egg, and embryos have become increasingly popular after the recent studies from other species. It is stated that women who had transfers of fresh and frozen embryos obtained 8% additional births by using their cryopreserved embryos. The goal is to cryopreserve the oocyte rather than the embryo to still prevent age-related fertility decline, but also eliminating that religious concern, moral concerns, or even issues related to the father. These oocytes were cooled at a rate of 0.3 degrees Celsius per minute until a temperature of negative 30 degrees Celsius. Then the rate of cooling was increased to 50 degrees Celsius a minute until negative 150 degrees Celsius. The oocyte was then plunged into liquid nitrogen. This style mainly prevents internal formation of ice crystals. For vitrification, it is also known as rapid cooling. For this method, ice is not a concern because the cooling process is way too fast, but the high concentration of CPAs could be toxic to the oocyte. For the cryopreservation of red blood cells, blood is only able to be hypothermic preserved for up to 42 days. For cases where the demand for blood is high, like in wars or natural disasters, the blood bank needs to have a reliable system for storing the blood long term. Cryopreserving the blood has been the most reliable means for preserving these cells. There are two methods for cryopreserving red blood cells, and it is high glycerol slow cooling technique and low glycerol rapid cooling technique. The high glycerol slow cooling technique is done by adding glycerol to red blood cells gradually until a concentration of 40%, and then it is slowly cooled to below negative 165 degrees Celsius. The low glycerol rapid cooling technique is done by suspending the red blood cells in a low concentration of glycerol, roughly 10 to 20% concentration. Then they are rapidly frozen by immersing them in liquid nitrogen. Cryopreservation on kidney tissue. When the kidney loses function, the most typical course of action is to put the patient on dialysis. While this fixes the problem initially, it establishes a negative quality of life and can lead to heart disease and infections. Organ donors are highly sought out, but are hard to come by. Bioengineered organs are being designed to be used as potential organ replacements, like you see in this cryopreservation on kidney tissue. This process begins with decellularization of the entire cells except the extracellular matrix on the kidney. A scaffold is then created, which is a structure for the cells to attach to. Once these fabricated kidneys are made, they get cryopreserved, which improves the scaffold's biomechanical properties. The CPAs also minimize the effects of freezing on the vascular integrity. The cryopreservation on ovarian cells. Ovarian cancer has very few treatments: chemotherapy and radiotherapy. In both cases, healthy cells die alongside the cancerous ones, and there's no way to target them. All the ovarian tissue gets killed, and women are no longer fertile after these treatments. To preserve the chances of pregnancy, most women cryopreserve their embryo or ovarian tissue to have a baby later after treatment. The ovarian tissue in the study was taken from reference tissue collected during ovarian drilling and tissue from patients who underwent ovarian tissue cryopreservation. The method used was slow cooling, manual seeding, and then storing the tissue in liquid nitrogen. The samples were then thawed with rapid thawing. There was no significant difference observed for cell yield or cell viability when comparing fresh to frozen thawed tissue. All these studies find that slow cooling paired with rapid thawing methods for cryopreserving the cells to be superior, regardless of the type. The use of CPAs is also commonly used among all studies, especially when undergoing vitrification. They all found the fresh to compared very well with the frozen thawed counterparts. All studies emphasize the importance of cryopreservation in preserving reproductive and organ tissue. They all highlighted the methods that are enhanced survival rates and minimize damage. There were disagreements on the vitrification, although vitrification and slow cooling methods for oocytes showed differing results on survival rates and complexity, with vitrification being more effective but technically challenging. The research proposition that I propose is to investigate the efficacy and success of less toxic CPAs in enhancing the survival rates of cells during cryopreservation. My experiment would begin by selecting the CPAs. I would need to synthesize a range of concentrations of CPAs that focus on natural compounds that are alternatives to the highly toxic and traditional CPAs. I would then test using in vitro. I would isolate the oocyte and expose it to traditional CPAs and my synthetic CPAs to propose a control and experimental group, respectively. I would then begin with slow cooling and vitrification to determine the best suitable technique. This will allow for comparison on ice formation and cell survivability between rapid cooling and slow cooling on the traditional CPAs and the newly created ones. After rapid thawing, the oocytes can then be studied. The membrane's integrity, metabolic activity, and internal network are all aspects that would determine how viable the oocyte is. The experimental CPA oocyte would be compared to the oocyte that encountered the typical CPA. In conclusion, cryopreservation is a revolutionary technique for preserving various biological tissues, including oocytes, red blood cells, kidney grafts, and ovarian cells. Through different methods like slow cooling and vitrification, researchers have made significant improvements on enhancing cell viability and minimizing damage during freezing and thawing process. And here are the references. Thank you so much.